Do you know that almost two-thirds of the world's population is lactose intolerant? What is lactose intolerance, and what causes it? Lactose intolerance signs you should watch out for. Without wasting time, let's get started. History of humans and cows. Let's travel back in time to approximately 12,000 years ago, shall we? As humans began to migrate out of their nomadic lifestyles and into agricultural practices, they also began to conquer new land. Agriculture led to the domestication of animals, and by between 10,000 to 5,000 BC, humans had successfully tamed a wide variety of species, including cattle. It is debatable how and why humans began domesticating cattle in the first place. Nonetheless, it can be stated with absolute certainty that it resulted in some benefits. They provided rigorous labor on the farms, their skin was turned into leather, and their bones were possibly used as weapons for hunting or jewelry. Of course, not forgetting the milk cows produce. When food was scarce, milk could have provided an alternate source of nutrition for those who needed it. Research suggests that adult humans lacked the enzyme lactase until the domestication of cattle. Consequently, some European people developed a mutation that allowed them to keep their lactase enzyme active into adulthood. This allowed them to continue drinking milk without experiencing any adverse side effects associated with milk consumption. Larry David couldn't have said it any better. I tolerate lactose like I tolerate people, which is kind of cool. But not everybody is so lucky. Nature can take the opposite route, leaving an individual without this ability, which we will discuss shortly. The gene variant became prevalent among populations due to the attribute, which turned out to be advantageous. So people who maintain their ability to digest milk well into adulthood are referred to as lactase persistent. Don't forget to subscribe to this channel if you need more of the superpower, which gives the gene mutation. On the contrary, the inability to digest lactose, a sugar found in milk and other products made from milk, is known as lactose intolerance. If your small intestine does not produce enough lactase to break down lactose for absorption, you may suffer lactose intolerance. Have you ever met anyone who is lactose intolerant and serious about their lactose intolerance? Who would give up a delicious pizza, ice cream, or cheese? Not even Miley Cyrus, who is a certified lactose intolerant celebrity. Just kidding. As a matter of fact, lactose intolerance affects between 50 and 70% of adults worldwide, but dairy products remain on top of the list of foods consumed regularly. It affects a disproportionately high number of people of Asian, African Mexican, and Native American descent. However, we must quickly point out that having a food allergy to milk and lactose intolerance are very different conditions. The two shouldn't be confused. What if you find yourself among the unmutated majority? Should you give up dairy products altogether? Let's find out what the experts recommend in a moment. Causes of lactose intolerance. Lactose intolerance is hereditary, typically inherited from one generation to the next. In situations like these, a person's body may produce less lactase enzyme over time. It's possible that you won't notice any symptoms until you're an adult or a teenager. Following an accident or after recovering from an illness or infection, the small intestine may stop producing lactase in some people. Prematurely born babies may not be able to produce sufficient amounts of lactase in their bodies. In most cases, this temporary issue will eventually be resolved. Although it is extremely uncommon, some people are born without the ability to produce any lactase at all. Signs of lactose intolerance. Again, lactose intolerance symptoms vary in different people. Symptoms often occur between 30 minutes and 2 hours after consuming lactose from food or drink. Among the possible symptoms are gas or bloating, diarrhea, cramps and aches in the abdominal region, nausea. Of course, the severity of your symptoms will depend on the amount of lactose you have consumed and the amount of lactase your body produces. Treatment for lactose intolerance. No medication or treatment can increase the amount of lactase that is produced by your body. Altering your diet, on the other hand, will help you better control your symptoms. People who were lactose intolerant in the past were counseled to abstain from consuming dairy products. Today, professionals in medicine recommend that you experiment with various dairy foods to see which ones cause fewer symptoms. This way, you won't have to worry about not getting enough calcium or other essential minerals from dairy products. The following are some suggestions to help you handle your lactose intolerance diet. Consume milk and items made from milk along with your other food items. You might discover that your symptoms improve if you consume milk or items made from milk in conjunction with your meals. You could like it if you ate cheese with crackers or had milk with cereal. Consume dairy products that have lactose levels that are more naturally low. Hard cheeses and yogurt are examples. Alternatively, you can look at milk and milk products with the lactase enzyme added to them. If you found this video insightful, you might want to check out our video on artificial sweeteners weight gain to learn the impact of artificial sweetener on body weight. Thanks for watching.